I'd like to tell you a little bit about what a total hip replacement is, what's involved in the surgery, what you can expect before surgery and after surgery. Fortunately, if you're looking at having a hip replacement, just know that it is one of the most successful operations in all of medicine. I always tell people that if I had to choose, it would be a hip replacement that I would pick over any other major orthopedic surgery. So this is a model of a hip replacement, and I'm going to go through exactly what's done during your surgery, and then we'll talk a little bit about what you can expect leading up to surgery. First, and this would represent your pelvic bone, we create a new socket in the existing socket, and then we put a titanium cup into there, and that grows into the bone over the course of a few weeks. Inside the titanium socket, a polyethylene or plastic liner snaps into place, giving you the new bearing surface for your socket. Similarly, on the thigh bone side, we remove the arthritic femoral head, create a new channel inside the thigh bone, and then a wedge-shaped stem with coating on the top third that allows for bony ingrowth goes into the femur, and in a few weeks it grows in, and the femoral head goes onto the stem. The head can be made out of metal or ceramic. In this case, this one represents a ceramic. Then these two come together and form your new total hip or your new hip joint surface. And this allows for excellent range of motion, pain-free motion, and a very high level of function. Hip replacement involves putting a new socket up in the pelvis bone, and the pelvic bone would be represented by this model here. And what we do is take a titanium cup and make a new socket up here, impact the titanium socket up into there, and then a plastic liner goes into that socket. Similarly, in the thigh bone, we take off the arthritic femoral head, we create a channel down into the femoral bone, and a new stem made of titanium and coated with a substance that allows bony ingrowth goes down into the thigh bone, and then a head, in this case this one is ceramic, and sometimes they're metal, sometimes we use ceramic for younger folks, goes onto that stem, and then these two come together to form your new hip surface. And so there's no more arthritis, you have a nice new hip that moves around and gives you a painless joint that allows you to function very well. In fact, most people, after a short time, will tell you they can't even tell they had a hip replacement. It just feels like a normal hip to them. You can pause it after that.
I can pause it
I'll
here.
edit that out. Okay, I'll put this back here. That sound good?
That sound good.
All right.
I'm trying to think if you did anything in the knee that you didn't for the hip.
Well,
Complications will be used for both.
yeah, and I'll talk a little bit about preoperative. I can talk about the genetic testing. That stuff's pretty much the same.
Okay.
Yeah, for knee or.
Can you just say it again, just in case you said knee?
Yeah. Okay. Prior to your knee replacement, we'll do several different things.
Hip.
Oh, yeah. Prior to your hip replacement, we do some new. Let me start over. Okay. Prior to your hip replacement, you'll be required to have a visit with our hospital internal medicine team to go through your overall health status to make sure that your health is optimized prior to your hip replacement. do that in order to make sure we avoid complications. If that goes well, then you come in the day of surgery. The anesthesiologist puts an IV in your arm, you get a nerve block around your hip, and then a general anesthetic for surgery. Surgery takes around 45 minutes, and then you go to recovery room. After the recovery room, you'll go upstairs, and a few hours later, we'll have you up walking. You stay overnight in the hospital, and most people go home the next day. Occasionally, and this is generally in folks who are older, in their mid to late 70s or older, they'll stay 2 nights in the hospital. But for the most part, people can go home now with just 1 overnight stay. What else were we going to talk about? Oh, the preoperative. Before your surgery, or actually, one of the, it's one of the new and exciting, it's not really new anymore. One of the, okay. Prior to your hip replacement, while you're here in the office, we'll do a genetic test to check and see how your body metabolizes a whole host of medicines. What I'm primarily interested in is how your body metabolizes pain medicines, so that we can tailor your postoperative pain management regimen specifically to your genetics. This is the personalized medicine you sometimes read about. Also, we'll check for blood clotting genes, and as long as those are normal, I don't know, okay. Oh, the other thing we use the genetic testing for is to look at blood clotting genes to make sure that you don't have any extraordinary blood clotting risk. You can just take that. Okay.
Anything else you want to add for the hip?